Welcome and thank you for your interest in the University of Wisconsin Neuromuscular Medicine Fellowship. My name is Michael Hansen. I'm an assistant professor in the Department of Neurology. I'm also the program director of the Neuromuscular Medicine Fellowship. We are a one-year ACGME accredited fellowship in neuromuscular medicine, offering one position per year. We're seeking neurology or physical medicine and rehabilitation graduates who are dedicated to the care of people with diseases of the peripheral nervous system. Our section has 5 neuromuscular staff physicians and 1 physician assistant. We're a close-knit group. Having this many staff for 1 fellow position means that you will have a lot of one-on-one time with individual attendings and a lot of one-on-one teaching, which I think is a really great opportunity to hone your skills in neuromuscular medicine. We also come from a diverse background of training, including Mayo Clinic, WashU, Case Western Reserve University, Cincinnati, and the University of Illinois Chicago. Each of us brings our own perspective in caring for patients with neuromuscular diseases, and I think that's a really true asset of our program. A little bit of background on the UW School of Medicine and Public Health. We're a very large tertiary care facility associated with a world-class university. Campus-wide, there's a tremendous amount of funding, much of it going into health and neuroscience. And UW Health serves more than 600,000 patients annually at 7 hospitals and more than 80 outpatient sites. You'll see on the map on the right, we're located in the south central part of the state, and we really service patients from throughout the state and northern Illinois, Iowa, and Minnesota. What this translates to in the neuromuscular clinic is that you have a very high frequency of neuromuscular diseases. And we really see the whole wide gambit of any condition that you can think of that you would want to see as a neuromuscular fellow. As a neuromuscular fellow, you'll be working in 2 EMG laboratories. On our main campus, pictured on the right, we have 4 EMG rooms and a dedicated neuromuscular ultrasound room. And on the connected VA campus, which is a short few-minute walk indoors, we have 2 EMG rooms, also with associated neuromuscular ultrasound being available. Between the 2 laboratories, we have 5 full-time techs, and we do basic to advanced techniques. This includes facial stimulation, repetitive stimulation, and single fiber electromyography. One unique aspect to our program is how we perform the majority of our muscle biopsies. As you can see in the pictures below, we have a large needle that we use to do bedside or in-clinic muscle biopsies. And needle muscle biopsies can sometimes get a bad rap, mainly due to specimen quality or the size of the muscle biopsy. We have none of those issues, and often our needle biopsies turn out better than some of the open biopsies that we perform. This is a technique that you can learn as a fellow, and it really helps us have a low threshold of adding that pathologic data to clinical electromyographic and genetic data in the muscle diseases that we treat. We also have a weekly muscle lab conference, and this is one of my favorite parts of each week. It's where we all get together, can talk about cases, and go over pathology. It's a collaboration between our pathology department and our neuromuscular neurology section. And we review both our internal and external biopsies. So you see the biopsies that we all do in our group, but you're also seeing biopsies that are being sent from around the state and northern Illinois. We are also a leader in neuromuscular ultrasound. For those of you who've attended the AANEM, you know that this is a rapidly expanding area of that conference, taking up almost half of the education sessions. Neuromuscular ultrasound is integrated into our electrodiagnostic laboratory, where we're often performing nerve conduction, EMG, and ultrasound all in the same day and integrating that data together. We're the first neuromuscular ultrasound program in the state. And we have a dedicated curriculum with hands-on training to learn all that you need to know about neuromuscular ultrasound so that you can practice independently. One of the foundations for caring for patients with complex neuromuscular diseases are multidisciplinary clinics, We have several multidisciplinary clinics, including the ALS Multidisciplinary Clinic, adult and pediatric MDA clinics, and you can see our very own Dr. Wakelik on the MDA website on the right. We also have collaborations with rheumatology, hematology, cardiology, and neurosurgery in clinics dealing with myositis, Sjogren's, amyloid, and brachial plexus injuries. We have a couple unique aspects to our multidisciplinary clinics, including integration of genetic counseling. We also have a palliative care and neurology trained physician in our ALS multidisciplinary clinic. We have several areas of active research into neuromuscular conditions, and you can see some of these examples on this slide. Important to us is making sure we have a fellow pick a project that they're very interested in. And this can be in the research side, it can be quality improvement. We're really flexible in what type of project a fellow picks. Our hope is that by the end of the year, we have a tangible product that can either be implemented into the clinics or publishable. Our program will target about 50% of the time in the neuromuscular clinic, 40% of the time in the EMG laboratory, and the other 10% spread out through the other aspects of neuromuscular medicine, including pathology, neuromuscular ultrasound, elective time, and research. You should expect to perform 400 to 500 EMGs, 75 to 100 neuromuscular ultrasounds, and also evaluate the full spectrum of neuromuscular disorders. As the only fellow in our program, you'll have the pick of the cases that you want to see. So for instance, if there are several carpal tunnel cases, but there's a myopathy evaluation or neuromuscular junction disorder evaluation, you can prioritize doing that study. We also have an emphasis on longitudinal follow-up. Ideally, we want you to be able to see a patient for a new evaluation, plan what workup needs to be done, perform the EMG and or ultrasound on that patient, and then see that patient for follow-up. Our schedule will be fairly well set throughout the year, so you will know what days you're in clinic with certain attendings and know what days that you're in the EMG laboratory to help enhance this longitudinal follow-up that's pretty challenging to get in a one-year program. Our didactics include both hands-on and more traditional lecture formats of learning. We have a front-loaded foundational nerve conduction and EMG curriculum, which is a series of lectures as well as hands-on learning with the attending of different nerve conduction and EMG techniques. This takes place in July, so you can really hit the ground running in our EMG laboratory. We also have a dedicated neuromuscular ultrasound curriculum, which will start following the conclusion of the nerve conduction and EMG curriculum. Throughout the year, we have weekly to bi-weekly journal club, book club, and clinical disorders review that really cover the whole spectrum of neuromuscular diseases. We have weekly neuromuscular pathology education in the muscle lab, but also a dedicated education sessions teaching how to read muscle biopsies. And our department also has weekly neurology grand rounds. On the right, you can see some of the textbooks that we use in part in our curriculum. Upon graduation, you'd be able to sit for the ABPN Neuromuscular Medicine Board and the ABEM Electrodiagnostic Medicine Board and Neuromuscular Ultrasound added qualifications. I think this sets you up very well to be an appealing candidate for a variety of positions, including an academic position all the way to private practice and anywhere in between. So a little bit about our city, Madison, Wisconsin. We're consistently rated as one of the best places to live in the country, and we're rated third for quality of life in the US in 2024. We're a medium-sized city with the amenities of a larger city, but also the friendliness, pace, and ease of daily life of a smaller city. It's pretty easy to drive around Madison. You can usually get anywhere within 20 minutes. We have a great access to a highway system, fairly close, about 90 minutes to Chicago. Madison's also incredibly beautiful. You can see in the picture on the right, this is our Capitol building with the Monona Terrace designed by Frank Lloyd Wright on the front, and our two lakes, Lake Mendota in the back and Lake Monona in the front. There's always something to do in Madison, Wisconsin. On the top left, this is Olbrich Gardens, which is a beautiful place to walk around on a summer day. Bottom left is Henry Vilas Zoo, which is actually free to enter, so a great place to take the kids, or if you're just yourself interested in seeing some cool animals. On the middle top picture, this is Camp Randall Stadium, where our football team plays, but if you're not into football, we also have basketball, hockey, volleyball, in addition to semi-professional baseball team and a soccer team. In the bottom middle picture, this is Taliesin, which is Frank Lloyd Wright's summer home, and it's located immediately west of Madison in what's called the Driftless region, which has beautiful rolling hills. On the top right, this is State Street, where a lot of our theaters are, as well as a really great restaurant scene. You can see the Capitol in the back. The bottom right picture, this is our very popular weekend market, farmers market, which they close down the roads around the Capitol, and it's a great place to walk on a nice summer day. In the grand scheme of things, Madison is a very affordable city. It has the benefits of being a slightly smaller city, so you're not going to be getting rent rates of Chicago or LA or anything like that. Our stipends as a program are fairly generous, and your dollars will go further here than a much larger city. Residents and fellows live all throughout the map on the right. There's many different settings that you can live in. So if you want a downtown apartment, there are many of those available. If you need a home for family or dog, things like that, there are plenty of homes that you can rent in the east or west side of Madison. And then also a lot of suburbs that, again, are very drivable. Maybe a 10 or 15-minute commute from the suburbs that you see circling Madison, but they are very doable. So overall, I think Madison is a very nice, balanced city. You'll get this big city amenities, but you won't be necessarily paying all the big city prices that go along with that. So I want to thank you for the interest in our neuromuscular neurology program. If you have any questions, please feel free to reach out to me. My email is right here at hansen@neurology.wisc.edu. And I'll leave you with two final pictures. So the picture on the left is, again, kind of an aerial view of our whole medical campus. And then on the right, this is going to be your view from the VA EMG laboratory. So a really nice view of the lake. Take care.